So you have a patient, a woman, and you're aware that she's HIV positive. Few days later, this same lady walks into your house, your home, with your brother and is introduced as your brother's fiancée, wife to be. Naturally, there's a pause in your brain because aside from being a professional, you're also human. So you're having a conversation with your brother and it just dawned on you that he's oblivious of her status. He doesn't know in this case. Interestingly, she calls you to the side and threatens that she's aware of her rights as a patient to confidentiality of her status. The audacity, yes. Because of course, there's code of ethics to back up some of the conduct in nursing practice. What do? There is a tie. Confidentiality or family loyalty. So this was a post I made on my TikTok page sometime last year. I think I even put it here on YouTube Shorts. And the engagement I got from nurses, medical personnel, nursing students, like it was epic. Different opinions guiding nursing ethics, nursing dilemma, and it was literally the highlight of my 2024 with regards content creation. Of course, content creation and engagement are like this. Anyways, Anastasia Obilo here, and let's just get into this comment and responses I got from this question, and I want to hear yours as well, hence why we are digging into the comments. So this person says, I will sit her down and help educate her and tell her the risk of hiding from her partner. Tell my brother to know his partner's status. I feel like that would just sound suspicious. So this person says, I would just go to prison, ma'am, because I would tell him. Oh. Really? That's your judgment? I think prison sounds like pretty much extreme. I think you are likely to lose license first before prison. Prison sounds extreme. So I love this response. This is obviously maybe a medical personnel. He says, in the principles and practice of nursing, 1 is to save life, 2, alleviate suffering, 3, to promote health. In life saving, you have to do it. That is, tell your brother in this case. So in life saving, he is saying that you have to tell your brother. So nursing code of ethics, I think it's important that we briefly touch on this, like the whole principle of confidentiality, just so that you will resonate, just so you will know where some of these comments are coming from, or should I say responses are coming from. What does the principle of confidentiality say? It says a nurse has an obligation to protect the privacy of their patient. It's an obligation, not a right, not a choice. An obligation. You're obligated to, as a nurse, as a professional. So you have no business sharing a patient's medical information without their consent. Emphasis on without their consent, not even with their family members without their consent, not to talk of with your own family members or friends, as the case may be. Unless, of course, in cases of patients that are minors, mentally unstable, you get it. If you don't get it, forget about it. So this person says, be the first person to report her to the public health department. She is also not supposed to spread it. That sounds like a plan. So another person says, encourage your brother to do all screening tests before marriage as soon as possible. You can't directly tell him, which is a very difficult decision to make. Either do this or kiss your license goodbye in court. You see what I told you about being at risk of losing your license? So, okay, this one is very funny. Another person says, photocopy her test results, put it in a file, leave the file half open in a place that the right eye will see it. Ensure the name is exposed. This sounds like what will happen in a movie, Nigerian movie to be specific. Another person says, "Shebi una go reach house." Okay, okay, as in another person says, "This is very interesting, but come to think of it, oh, if your brother doesn't know in this generation that sex is like handshake, it might have already been too late." Hmm. He's quite right. Like abstinence now is sort of bizarre for most people. Hmm. And I think I responded to this guy. I was like, they could be abstaining and waiting for marriage. And he said, even me, I don't believe my response. Meanwhile, this is the ideal. You don't just have unprotected sex with somebody you don't even know their status. It could be something else. It could be something else. Maybe not HIV. There are STDs here and there. So I don't know. I don't know. This person used the F word. I go okay. I go tell am. I go tell am direct. Nothing. Really? I wouldn't use that word on my profession. Okay, another person says, I would tell him to make sure they are aware of their health status as a couple, take tests like fertility tests, genotype, blood group, STD, STI, hepatitis B and C, mental health assessment to avoid risk. It's like just telling them, go and do general health assessment before getting married. Yeah, they'll just take it that, my sister, my brother is a nurse and he or she advises that. Okay, my sister is a nurse and my sister is a nurse and she advises that we do all these health check before getting married. Another comment says retroviral screening positive, another term used for HIV plus. Yes, I forgot to mention that when I made that post, I didn't directly use HIV positive. I was like RVS positive. Yeah. What to do? Carry your brother japa. Is it that easy? Do you have that much money? Okay, maybe by japa they just mean carry your brother run, not literally like japa of leaving the country. So another question says the first three words is already making me laugh. Make thunder fire pledge. I no go even think am twice. I go tell my brother ASAP. Which kind mumu pledge? Yes, I also added in that particular post that remember you have a pledge to confidentiality. Anyways, let's move. I'm trying to see how much of these comments we can touch, so I don't want to dwell so much on anyone. So another comment says, I invite my brother home. We discuss as family members, not as medic and a patient. That time I will be on my family duty. I feel like it's obvious which side he is on. Blood is thicker than water. Losing yours should be the option. Blood is thicker than water. Losing yours should be the option. I think this person meant to say losing yours shouldn't be the option. I guess so. Because he says blood is thicker than water. So I'm guessing that losing my brother to becoming, even if you are practically not exactly losing your brother. I think we have gone past the age where HIV is like death sentence. So this next response is quite interesting and valid. So he says, first of all, the woman will be placed on antiviral to reduce the chances of transmission. Then encourage my brother to know his partner's health status. Valid. So Pinky says, okay, I wasn't mentioning names. So she says that remove uniform, talk to her woman to woman. Let's dig it. And I even responded with better plan. Let's talk this thing out. So, auntie never marry my brother or enter family. She get mind to dey confront me. The audacity. I feel you, sister. She really has audacity, because it's the calling me to decide for me, to actually confront me. Cancel the woman to tell her fiancé if they decide to go ahead with the marriage, to educate them properly as to preventing her infecting him. This sounds like a plan. Very ideal. Very, very ideal. So another person says, advise them to go for tests so he's gonna find out by himself, saving yourself from being the one to ruin their relationship. After the test, he will be the one to make the decision whether to continue or not. Don't be the one to put asunder. Don't be third party. Don't be that family member that they are binding and casting against. After the test, he will decide if he makes the decision to leave or not. Okay. That makes sense. I love your response. Force my brother to know his status and also force him to make sure he knows his partner's status too. I will ask for evidence. If my brother knows that I'm a nurse, he won't put me on deaf ears. Okay. Another person says, who confidentiality help? My brother is the most precious to me. Lord. I feel this person is just straight to the point. Nothing for you. I will advise my brother. Another person says, family over Nightingale. Okay. Are you sure the mother of Nelson will be pleased to hear this? Are you sure Nightingale will be pleased to hear this? So another person says, does your pledge not also say you should save lives? Come to think of it. But are you really ending his life? Are you? So this person says, tell him that she's positive, but don't tell her that I told you. Are you sure your brother will not snitch on you? Do you trust that your brother will not snitch on you? We're talking about a woman he loves and wants to marry. Okay. If you say so, brother. So I think this is the last comment I'm taking because I don't want this video to be too long. I would advise my brother to go for a complete medical screening with his partner, educate him on the importance, and tell our parents to emphasize. Your parents are going to escalate it, trust me. They are sure going to escalate it. Anyways, let me know what you would do if this situation was presented to you. What would you do? Family loyalty or confidentiality? Because it's a tie at this point, and you've seen some of the response from not just medically inclined people, but also just I don't want to say layman. I don't want to say a typical layman, but let's leave it at that. But don't say I said that, please. Anyways, you guys have heard this comments, you guys have heard these responses from some medical inclined personnel and others. Others. But I'm also interested in hearing yours. Let us know in the comment section. Let's make this a whole discussion. And let me know, what would you do if this scenario was presented at your doorstep? What would you do if you were this nurse? Let us know in the comment section. And again, let me know what was the highlight of your 2024 with whatever you're doing, career-wise, family-wise. What was the highlight of your 2024? And you guys, do not forget to subscribe, like this video, leave me a comment. It's important that you leave me a comment, share your thoughts with me. Let me know what you guys are thinking with regards to this particular scenario, and I'll sure see you all in my next one. Bye.